If your child's struggling with nystagmus, I want to show you a pre and post video here, and I want to explain how activating the brain can actually improve that dramatically. So this little girl came in, and she had, this was after a surgery, she had nystagmus, really severe nystagmus, when her eyes would travel to the left. She had big beats of nystagmus. And then when we do a quick head maneuver called vestibulocular reflex, where we have her fixate, turn her head, when her eyes would go to the left, she'd have large nystagmus as well. This is actually, when we track our eyes to the left and we move our head quickly to the right, we're actually activating our right cerebellum. So what you're seeing is she has dysregulation of that cerebellum on the right-hand side. So when we do those movements, we see larger nystagmus. And when her eyes go to the right, she doesn't have that same response or nearly as severely. But all we did in this video is we didn't work on her eyes at all. We didn't do a single thing with her eyes. All we did was we lasered her cerebellum on the right-hand side. We did different activities to stimulate her cerebellum. We worked on her primitive reflexes. We worked on her balance centers, and those all help integrate the cerebellum more appropriately. And what you can see after this is when her eyes now track to the left, she still has just a tiny bit of nystagmus, but it's so much better and so much more efficient. And when we do head maneuvers to the right, her eyes can stay much more stable just by getting that area of the brain healthier. So just because your kid has an eye tracking issue or has nystagmus and is maybe struggling with some learning-based issues because of it, doesn't necessarily mean the only thing you need to do is vision therapy. You can stimulate their brain, these weak networks in the brain, and you can get the brain to integrate more efficiently and get more stability of those eyes. So I wanted to show you guys that, give you guys some hope. If your kid's struggling, check out, look into their primitive reflexes, look into their balance centers, and look and see if these other systems may be playing into it as well.